Hi everyone, I am Dr. Kanish Kumar Singh and I am going to host two of the big pulmonologists of India in the episode of Life of a Pulmonologist. In this, we'll be talking about a lot of things apart from academics, about what they feel and what they have gone through in their real life so that young pulmonologists and my compatriots get the benefit out of it and get the insights from their life and their experience. This is the first episode and I welcome Dr. Randeep Guleria sir and Dr. Deepak Talwar sir. Sir, we welcome you to this episode.
Thank you.
And in this episode, we'll be talking about the finances in healthcare and the ethics which comes to you, or maybe when you are seeing the patient, uh, this dilemma which comes to your mind. We'll be talking about that. So I'll start with the first question. So my first question will be to Randeep Guleria sir. So, in past, medical field was considered, the doctors were considered as a very noble profession. But with the development of healthcare system, the finances came into play. So, how do you see that? And when you started seeing the shift of this noble profession and that business taking over into that?
So, thank you for inviting me. To begin with, you're very right. In my lifetime, I would say, and through my career, I've seen the whole shift from medicine being a social service to becoming a business. And I think a lot has to do with the advancement that have happened in medicine and the way the practice of medicine has changed. So, we started off with medicine being more of a clinical medicine. During my time as a resident and others, you would examine a patient in detail and make a clinical diagnosis. We moved from clinical medicine to investigative medicine. You would not get a CT scan done and X-ray was good enough. Now you get a CT, PET scan and other things done. So the cost of healthcare has gone up dramatically because investigative medicine has come in very much as compared to what clinical medicine was. Secondly, medicine has become more from a public sector responsibility to a private sector responsibility with a lot of corporate hospitals, commercialization happening, and that has changed the whole face of medicine from what you said was a service to a business. And I've seen that happen during my lifetime and during my practice years. I feel it's a little bit unfortunate, but that is how things have evolved.
So shift from clinical medicine to modern medicine, and modern medicine is a lot dependent
Investigative
upon
medicine.
heavy investigations, and it's more getting into the westernized way of looking at it. But that's the fact of life, because you can actually diagnose many things very early, but you need many tests, which are very, very expensive.
Sometimes you feel that the test is not needed, but still you do because you think that patient might ask, or maybe they ask you that how can you diagnose it clinically. So that has ever put you pressure to do any test of any patient?
I think besides we being, being more inquisitive to ask for more tests, I personally feel that even the patients are more interested in knowing exactly what is going on with them. And that puts an extra pressure on us to see that, we are not missing out on something. And that is like a host of tests which are happening. But I will always give this clinical pearl, which me and Randeep got together from Dr. Jindal. Never order a test. Once the report comes, you are not able to interpret and know what to do next.
Very nicely said, sir. So now we move on to my next question, and I'll start with you, sir. So, navigating the ethical dilemma, how do you think the doctors can balance this ethics versus the finances in this modern healthcare system?
I think it's an essential thing to do, but there's no formal teaching of ethics. I think what we learn ethics is what's the best way of practicing. But to balance it out for people who are like me and Randeep for 50 years in this, we have learned over a period of time. But I think it would be a challenge for the newcomers at this time, because they don't have, or they are not exposed to what, the evolution has happened.
So, have you ever felt the conflict that the test needs to be ordered or done vis-a-vis seeing the finances or seeing the business perspective from a healthcare facility in which you're working? Has it ever created a undue stress on you that needs to be done, this test needs to be done or not?
I don't think so. It's happened with me, but I know this is a normal phenomena at the moment. But Randeep has been in public sector since long time, but I have been in a private sector
That's yeah.
right from the beginning. So I actually grew over it, so didn't get the pressure. But I think the newer generation will get it much more.
So I think what is important is that we, as let's say senior members of medical fraternity, should take it to be able to do things ethically and set an example for the juniors. What we have learned is what we've learned from our teachers, and that was part of ethical practice that we learned. Now with the bigger challenges happening because of corporatization, a lot of push and finance becoming an important issue, it's very important that we maintain that strong pillar of ethical practice so that the younger generations can follow that and not get sort of swayed into doing things where one is looking at short-term profits rather than looking at long-term sort of gains and reputation. So I think what is very important for the young generation to understand is that medicine is not a sprint, it's a marathon. So you don't have to say that I want to really have financial gains overnight. You have to work ethically and build a reputation, and if you do that, your financial gains will come in an ethical manner rather than trying to do something which will cause problems not only for you but will also harm your patients in the long run. So I think that is very important. I have been in the government sector throughout. There the ethical dilemma has been a little less. You have had ethical dilemmas there also, but cost was not that much of an issue because you could always talk to the administration and get something waived off because the hospital was not paying for it, the money was actually going to the government itself. So you had facilities that this is a poor patient and it could be, you could sign on the form and that could be sort of done free. Having now moved into the private sector, I find that that is a big challenge because you can see that there are patients to whom getting this test really does pinch, but at times you find yourself a little bit helpless that you can't do anything. You could waive off your own charges, but you can't waive off the charges that the hospital has. And that is what is at times an ethical dilemma that many of us face, and we really need to see how to overcome that so that there is a way to be able to provide healthcare which is equitable, which looks after everyone irrespective of the socio-economic status, and is able to provide the best degree of healthcare, no matter whether you be in the public sector or in the private sector.
So you mean to say that even the young doctors, if they think wisely, can reduce the cost burden on the
Correct.
patients, if we start thinking and doing it practically and ethically, rather than jumping
My
into the lot
take
of
is that
things.
if you do practice ethically and you are able to talk to your patients, you have good communication skills, you are able to talk to your patients and you are doing it for their benefit, and you have the whole issue of the investigative medicine, that which is the science of medicine, but also a balance of the art of medicine in terms of being able to look at patients sympathetically with empathy and understand their issues, you will in the long run do much better. And therefore don't look at the short term gains, but look at it as a long term gain and of being able to do practice in a manner which is more satisfying. Medicine has two parts, it's not only the financial parts, it's the satisfaction that the profession gives to you, and it is a satisfaction which no other profession can give to you as compared to when you see that you've cured your patient who's
Saving
come
lives.
with issues which are not getting solved. That is a big satisfaction which is more than the money that you earn.
So you
So
are
I'll
from.
give you an example, that
Yeah.
another teacher of mine told me, when the patient enters into your room, you just exchange your chairs. You sit on that side and let the patient come on the other side. You will never go wrong. You will always be able to understand what they want and how can you deliver it. So I think empathizing with the patient is a very important aspect, and understanding the needs of the patient is equally important to chart out whatever you want. You may not have much negotiating power, But over a period of time, everybody learns how to navigate through all these difficult things.
So you are here working in a private sector for a very long time. So have you ever be able to like do things like that? That waiving of the fees, waiving of the charges, has the administration poked into you that you shouldn't be doing this, or you can't do the waiving of the fees of any patient or investigations in your hospital?
As Randeep said, the corporates allow you to waive off your portion completely, right? Only thing it comes to when you want to negotiate that, okay, I am doing everything, at least you do a little bit more so that the burden is decreased on the patient. I think my story is a little different because I was at the time when there was no corporate hospital. So these all came later on. So I think the struggle has been different altogether, and understanding was much different with the kind of setups in which I
Yeah,
have
exactly.
put my work.
So not everyone nowadays will get the perks which you have in terms of the relief you can give to the patient, your patient, in terms of the finances.
That I think that is true, because what was there 20 years ago when you had smaller hospitals, nursing homes, and facilities which could help in such a situation has all sort of become less and less. And larger corporate hospitals which are run like big businesses have come up in a big way. So like I said, medicine has evolved and changed so much, not only in terms of investigative medicine, even the whole issue of medical legal issues have come, and so the whole sort of background of defensive medicine, all of this has changed how medicine is being practiced, and corporate hospitals have now become the big players. If you start looking at health sector now, which was not there 20, 25 years ago. Even in the private sector, you had smaller hospitals where things were much different than what they are today.
So
That's
And
why
that kind of investments can't be put by anybody else. Actually,
Correct.
somebody has to put in huge investments to procure the state of art things, right? Both in investigation as well as in treatment. So if that is all required, then obviously you have to take everything in total picture and then try to navigate your way in a manner which is still holds
can
your
balance-
ethics
balance
with
things
you.
out.
Balance it out.
Because-
balance it out.
if you say you want the best care, then you're not only looking at the best investigations, you're looking at a best ICU, the best monitors, the latest ventilators, all the other equipment which comes in,
Even
high-end
the-
Even
investigations.
the medication, yes.
Yeah.
All of that comes with a cost, and therefore the cost of healthcare has become much more than what it was 20 years ago, where it was more of clinical medicine and all these costs were not there. This has happened to make medicine more precise. We are now able to diagnose and do things which we have never been able to do before. You could not see the chest like you can see now on, let's say, a CT or a PET, but that comes with the additional cost.
So, as you all know that I am talking to two of the stars of this field, pulmonology. So, I want to talk about the star culture in the corporate hospital. So, how do you feel that the corporate hospitals hiring up the big stars of our country in the department? So, how does it impacts the other doctors who are there in this department, the insecurity, or how do you feel about it? What's your take on this star culture practice?
I think it's a difficult question to answer because there are two types of stars. One are the stars who are already stars, and other ones are which become stars by getting attached to a very suitable setup where the growth can happen. So it's like a win-win situation for a lot of people, which happens. And but I think if you are really good, then you are good, right? So I do not know what the word star means. Is it's only the face value, or it's the overall the professional value of that individual?
I think
so. I
it's-
personally feel professional value is the most important thing.
Yeah.
So I think that's very true. It's not. It's important how you are in terms of your own practice, how good you are. That gives you what the so-called star, if you want to use that. It's something which is used a lot by the corporate this thing to attract, let's say, patients to their hospital. But having said that, at the end of the day, it's all about teamwork. So you may have one person who you may be this thing, but unless there is a good team, your day-to-day care will not be optimum. So you may be able to attract some attention because of, let's say, the so-called star culture, which I think is not right, but it is a team which works in terms of looking after the patients. So it's used a lot to try and publicize things, which is also part of what is happening in medicine. But what is more important, I think, in terms of value of a person is how good he is as a clinician and how much the patients respect him. And patients, actually, the word of mouth makes a big difference in terms of your practice rather than the so-called star label that you may get.
Which is slow but permanent. It won't go away.
And about the people, the doctors who are working in that hospital, should they feel insecure? Should they feel that why I'm not the star?
I think that happens in all fields.
Yeah, all
I
fields.
don't
That's
think
true.
so. It's only in medicine.
Yeah.
It would happen everywhere.
So
if there's a
every-
senior officer and the other officer comes in, it would happen everywhere.
So basically, you mean to say that everybody has their own timeline. Everybody will get through that, and everybody can become a star. And
It's a path. Everybody has to travel through that path, actually.
And you have to do it sincerely.
sincere.
Yeah. Ethically and sincerely. If you stick to that, everybody can reach there. There's no problem.
So coming to the last question, your idea of an ethical healthcare system, if you have been given a power to change something or let's say anything you want, what changes you would like to make in the system for the betterment of everyone, for the doctors and for the betterment of the patients?
I think that would be strengthening the public healthcare system, which is going to be ultimately the answer for this. That if we are able to do that, then I think it's going to be the winner. Otherwise, I feel that the amount of numbers which we have in our country, it will be very difficult to justify by any system. But yes, if there are proper checks and balances kept, I think we can actually provide the best.
So you,
So I would agree. I think there are two parts. One is we must focus a lot on preventive health, because as we move forward and there is more and more of non-communicable diseases, these are diseases which can be prevented to a large extent. And there has to be a system where you are able to provide health care irrespective of socio-economic status, whether it be insurance driven, whether it be government driven, whether it be driven by a policy, where it's equitable. All sectors, private and public sectors, are sort of working as a team and are able to provide health care which meets basic standards and which decreases or has no out of pocket expenditure from the patient point of view.
so insurance infrastructure, these are the main backbone of the changing of this
Absolutely.
healthcare
We have to grow in that direction also. We have become investigative, we have become more like westernized, but the insurance is not like that westernized.
Correct.
So that is putting us back, and heavy expenditure on the part of the, the pocket of the patients. So I think moving towards that will be definitely a step
So
forward.
it could be an insurance which is supported by the government and it provides equitable health through private and public sector, where everyone is covered, and therefore it's a win-win situation both for the private sector, public sector, and patients get the best health care no matter where they are. It's a big task and big ask, but
I think,
that's the only way I can think, because the cost of healthcare is not coming down. So you have to keep that in mind, and the cost of healthcare is not going to be something which the government sector can totally absorb, considering our population, considering the cost that is going to be there. So there has to be some sort of a partnership, both in terms of a common pool where whether the insurance comes in, patients also put in something, government puts in something, but that is also done in an ethical manner with checks and balances, so that it's not exploited and it can provide health care to everyone.
and especially giving more highlights on the preventive medicine
Correct.
rather than going
Early
for the
diagnosis,
secondary
early
interventions.
screening, preventive health, all of that.
So I will end this interview with one last question to both of you. What is the one piece of advice which you would like to give to the younger doctors like me to follow or to think upon, or whenever they go to the private hospitals or private sectors to work, what one piece of advice that they should carry home?
I think I will say one word: patience, and second, setting up realistic goals.
Yeah, so I think one is that this is a, like I said, it's not a sprint, it's a marathon. So slow and steady, you will establish yourself and do well. So not to be impatient, be able to really give it time. Secondly, remember that along with the science of medicine, there is also an art. So empathy to your patients, understanding their issues, being able to communicate well with them, are all things which will pay huge benefits in the long run.
Thank you so much.
Dividends.
Yeah. Thank you so much, sir. It was a wonderful discussion. I must say, I must admit that I never thought that I would be able to talk to both of you, and I think this is the first interview in the
When we are together.
history in the history, and I'm sure this is going to get viral because I'm very lucky and feeling very happy to be in front of both of you to take this interview.
Thank you,
so
Ganesh.
much, sir.
Thank
Thank
you.
you,
Thank
Ganesh.
you very much.
And we will be back with some other guests so that we keep doing these kind of conversation and learn something new apart from pulmonology about the life of the pulmonologist. Thank you. Keep watching.